I believe Margaret is most likely diagnosed with either social anxiety disorder or panic disorder, but I believe she leans more closely towards social anxiety disorder. Margaret's problem first started about a year ago. She was shopping one day, and she began to feel anxious, nervous, and panicky. However, it went away after a few minutes. Therefore, she carried on with shopping. 2 weeks later, the same anxiety occurred again, but worse. She could feel her heart beating fast, and she thought she was going to pass out. Ever since the event, it has been hard for Margaret to go out. Sometimes, Margaret would burst into tears for no reason. When this anxiety occurs, she usually leaves the place as a way of escaping, and she feels embarrassed for acting this way. These symptoms of Margaret are like the symptoms of social anxiety disorder. Social anxiety disorder caused more life disruption than any other phobias, and it surely has caused Margaret some life disruption, which is not being able to freely shop. Some symptoms of social anxiety disorder are intense fear, avoidance of social situations, fear of negative evaluation, exposure to trigger leading to anxiety about being humiliated or embarrassed socially. And social anxiety disorder usually onsets often at adolescence. Margaret's symptoms occurred about a year ago, which means it started at adolescence. Also, Margaret feared how other people will think of her and how other people will think of her in a very negative way, thinking that she was stupid. This is the fear of negative evaluation, because in reality, people do not really care about her and are too busy getting on with their own stuff. It's only Margaret who cares about other people's sights and how they will perceive her as. I would ask Margaret if she has any other medical conditions and if she is taking drugs or medicines. Because one DSM-5 criteria for social anxiety disorder is the fact that fear, anxiety, or avoidance is not attributable to psychological effects of a substance or other medical conditions. Therefore, if she is not taking any drugs or has other medical conditions, it is most likely to conclude that she is suffering from social anxiety disorder. I thought Margaret might have been suffering from panic disorder because its physical symptoms are labored breathing, nausea, and lightheadedness. Margaret has felt these symptoms: pains in the chest, she felt breathless, and nauseous. Also, Margaret says she burst into tears for no reason. Well, one of the symptoms for panic disorder is fear of going crazy, losing control, or dying. To understand more about Margaret's acts in bursting into tears, I would ask her where she would burst into tears, and what she felt like when she would cry, and why she would cry. Panic disorders, another symptom, is that when panic attacks occur, it reaches peak intensity within 10 minutes. Margaret said after she had left the shop, when she panicked, she came back after 10 minutes. So another question I can ask her is whether all of her panic attacks carry out for 10 minutes or within 10 minutes. During the therapy sessions, there was an agreement between the therapist and Margaret that she would keep a thought record for a week, so she may notice her negative thoughts. Also, that she would go to the supermarket where the last occurrence happened each day. Then focus on breathing and positive self-talk whenever she felt anxious. This is because her anxiety came due to negative thoughts. If Margaret would focus on positive thoughts and only focus on herself instead of focusing on other people, she will be able to relax and carry on with what she was doing before. Margaret also agreed to read the self-help guide recommended by the therapist. I believe she has a very high chance of recovery because she is willing to change. According to Margaret's story, she voluntarily looked up and read a self-help guide on the internet. This shows how much she wants to change, and this will lead to a positive outcome, which is recovery from social anxiety disorder.